When a person reaches the age of 70, the real danger is no longer the disease itself, but the excessive fight against it. Hundreds of tests, screenings, and so-called mandatory checkups are offered as blessings, but what once saved lives can now begin to do harm. Examinations that used to be tools of reason have become rituals of medicine, sources of fear, exhaustion, and sometimes irreversible consequences. This is not a theory. It's a reality that more and more people face when doctors start looking for problems the patient never actually felt. Colonoscopy is one of the most aggressively pushed procedures for older adults. It's labeled the gold standard, the key to longevity, the essential weapon of early detection. But behind this polished label lies a far more complex truth. The preparation is harsh. An intense bowel cleanse with real risks of severe dehydration, low blood pressure, and fainting. For seniors, these aren't mild side effects. They are serious threats, and the sedatives used during the procedure don't just fade away, they often leave lingering confusion, weakness, dizziness, and a much higher risk of falls and fractures. This isn't rare. It's the hidden cost of preventive care that often no longer makes sense at a certain age. What's even more alarming is how often the test finds tiny polyps that pose no threat to life. And yet, those minor findings trigger a chain reaction. More tests, repeat procedures, even surgeries. These interventions are driven by statistics, not by the individual's real condition. At 75 or 80 years old, a slow-growing polyp, one that might take 10 to 15 years to become harmful, often never matters at all. But once it's discovered, fear takes over. And that fear is hard to stop. Equally dangerous is the seductive idea of a full-body scan. It's presented as thorough, responsible, high-tech care. Watching every cell, every organ, it sounds impressive. But every little abnormality, every harmless shadow on the screen becomes a reason for worry, follow-ups, biopsies, sometimes even surgeries. People start treating things that were never going to hurt them. In trying to avoid illness, they end up trapped in stress, weakened by worry, worn out by overcare. Full-body scans rarely catch something truly deadly, but they often create the illusion of a crisis where there was once peace. Aging is not a malfunction. It's the natural movement of life. And today, the biggest risk is not missing a disease. It's being made to fear it so much that we destroy the health we still have. True wisdom is knowing when to say no to what's unnecessary. That's not neglect. It's a deeper form of care. Prevention must be precise, gentle, and intentional, not because life must be extended at any cost, but because dignity is part of health. After 70, it's not the number of tests or procedures that defines well-being. It's the ability to make choices from understanding, not from fear. And that may be the clearest sign of real maturity. Modern medical technologies can detect the tiniest changes in the body, but not all of them truly matter. Often, so-called incidental findings appear. Small nodules, shadows, anomalies that do not threaten your health and do not require intervention. But for a person who sees such words in a report, a real nightmare begins. A constant stream of worries floods the mind. What if? Could it be? And an endless cycle of follow-up exams, biopsies, and consultations starts, which can stretch on for months or even years. Aging only worsens the situation. What was simple and safe at 50 can now lead to serious complications. A small biopsy may turn into a risk for the lungs, infections, or prolonged recovery. Even a routine MRI can become a challenge due to pain and immobility in the joints. The psychological burden is a separate issue, rarely spoken about openly. Many elderly people live in constant fear and anxiety instead of enjoying the health they still have. However, incidental findings are only part of the problem. Tests like a general stool analysis can also cause excessive worry. The slightest deviation in results becomes a reason for further investigations, which often lead nowhere. This is called over-testing, looking for a problem where there is none. Patients lose energy, time, and money, experience fear, and often false hope. Full body screenings are rarely covered by insurance, and many older adults pay out of pocket, thinking they are buying peace of mind. But in reality, they end up trapped in a vicious cycle of endless tests and anxieties. With age, the approach to health must change. This doesn't mean ignoring symptoms, but it's important to learn to trust your body and your feelings. Not every shadow on a scan or minor lab deviation requires immediate action or worry. Another important point is cardiac stress tests, which are often prescribed to seniors almost by default. The treadmill test was once indispensable for detecting heart disease, but after age 70, these tests frequently yield false positive results. Blood vessels lose elasticity, blood pressure fluctuates, and ECG patterns naturally change, and the test mistakes these for pathology. As a result, a chain of additional tests, angiograms, catheterizations, and sometimes surgeries is triggered. It's a secret. The risks for elderly patients in such procedures are significant. Bleeding, kidney damage from contrast agents, dangerous drops in blood pressure, and difficult recovery from surgery. What began as a simple stress test can end with hospitalization and complications that greatly reduce quality of life. Recently, a 75-year-old patient came to me feeling perfectly fine with no complaints, but at his doctor's insistence, he underwent a stress test. The results were borderline, and after several examinations, he ended up hospitalized with avoidable complications. So, what should you do? The key is not to panic over every small finding. Remember, technology is just a tool, not a verdict. Your task is to learn to listen to yourself, your body, and your sensations. Not every abnormality deserves your fear or immediate intervention. Your health is not endless tests and procedures, but the ability to find a balance between attention to yourself and trust in your body. Remember, not everything technology sees requires your fear or treatment.